What we're about to do here is show you how to utilize the foam roller, which is one of the contents in your prehab kit. We're going to teach you how to use this as a stretching aid. Now the foam roller is used for self-myofascial release. It's a little like going to the massage therapist for a deep tissue massage. What we're going to do is use the foam roller to locate trigger points in muscles. Now a trigger point is like a knot. It's a point of maximum muscle tension. Now what we want to do is utilize that foam roller to release those trigger points. If we release those trigger points, the muscle will relax much more than it will with static stretching alone. So we're going to work through a series of whole body foam roller movements here to teach you how to do that. And we're going to start by rolling out the calves. So it does require to get become a bit of a contortionist to accomplish the mission. But here's what we're going to do. You're going to place either your left leg or your right, we'll start with our left, up on top of the foam roller, and you're going to put some downward pressure on it, and you're going to roll up the vertical length of the entire calf muscle. Now what we're doing here is we're looking for points of tenderness. That's a trigger point. When you find it, you'll know it. The pressure will actually induce a bit of pain, so it's not entirely a pain-free process. Now what you want to do is apply gentle pressure on that trigger point until it releases. So you'll want to work out all those hot spots, if you will. Now I want you to work around the entire circumference of the calf. That's going to require you to rotate the ankle or the lower limb, the leg, a little bit, and really try to find any hot spots, melt them away with some steady pressure. Work over that little bit of that surface area there until you feel it release. It may not release in one shot. Okay, we're going to go up both sides of the calf. And once you've done the calf, we're going to work up a little bit higher. We're going to start with the hamstring. So put the foam roller behind the knee and directly above the knee on the thigh. And we're going to work up behind the thigh all the way up to our sit bones. And we're simply just going to roll up and down. And again, you don't want to just roll the straight line. You want to rotate the thigh. Remember, the hamstring muscle group is composed of a number of different muscles, so we want to hit it from all different angles. So we're going to go all the way up to the sit bones. You might have to shift the position of the foam roller to get there. And again, what we're doing is looking for hot spots, those points of maximum tenderness, and we're going to use the foam roller and the weight of our body to apply the pressure we need to help release them. So you'll work up on the inner thigh side of that hamstring. We'll go all the way back up to the sit bone, and we're just going to apply some pressure there. If you're a little bit tender, stay there, work your sit bone back and forth across the top of the roller. Now what we're going to do is turn our body sideways, and we're going to work on the IT band, and we're going to start up by the hip. And that IT band is a dense band of fascia that runs from your knee all the way up to the side of your hip. So it's on the outer side, outside edge of your thigh. Now we want to work on the side that's closest to the hamstring, the back of our thigh that we just rolled out. And what we're going to do is we're going to roll all the way down. You start with the other leg out to the side like this. So we're not applying as much pressure, and you're going to work all the way down to the knee. Again, we're looking for those points of tenderness. And we're going to work up and down the side, the hamstring side of that IT band, looking for any trigger points. We're going to go up and down the thigh a couple of times, and then we're simply going to rotate over. Now when we rotate over, I want you to bring the opposite leg across the body like this. That's going to facilitate the movement, and it's going to allow us to get perpendicular to the surface of the entire IT band. Now it's going to be a little bit more painful, but we're going to work all the way up the entire length and back down again, from the hip down to the knee and back up. Steady pressure, and when you find a hot spot, I want you to stay there and just gently roll back and forth over it. Apply a little bit more pressure over the course of time and work it out. Now what we're going to do is slowly turn over a little bit more, and we're going to work down the quadricep. That's a muscle in the front of your thigh, all the way up along the quadricep side of the IT band. So we're going to work that out just like that. Again, we're looking for hot spots and we're rolling them out. So once we've done the IT bands on both the quadricep and hamstring sides, we're going to turn back over, and we're going to start back down on the other leg, and we're going to work out the calves again. So we're just going to apply that pressure. We're going to work around the entire surface area of the muscle, not just straight up and down the back of the calf. Again, we're just looking for those tender spots, and we find one like right there. We're just going to ease onto it. Roll it out a little bit more, all the way up to the back of the knee. But don't put too much pressure on the joint. If you need a little bit more pressure to get into a more stubborn knot, you can simply stack your feet on top like that and push down, get a little bit more weight on there. Remember, don't overdo the pressure. It shouldn't be extremely painful, but it will cause a mild amount of discomfort. Okay, so we're going to move from there. We're going to bring the foam roller all the way back up. We're going to start above the knee, but behind the knee, and we're going to roll out that entire hamstring on the other side. Steady pressure. And again, we're working all angles on that hamstring from the inner thigh side to the outer thigh side, looking for any hot spots once again. Fully roll all the way up to the sit bones. Want to roll out that insertion and the origin, both ends of the muscle. And then we're going to slowly turn over to the IT band side of the hamstring by rotating our body, not crossing the legs at this point. We want to make sure we get that foam roller all the way up to the base of our pelvis and the head of our femur or upper thigh bone. And they're going to roll down the side of that dense fascial bands on the outer side of your thigh till we find those tender spots, and we're going to roll those out. Okay, working down to the hip, from the hip to the knee and back up again. And then we're slowly going to turn over across the leg, get a little bit more pressure directly perpendicular to that IT band and roll it out the full length. It's going to help release that TFL, the muscle that connects that IT band to the crest of your hip bones. All the way out. And then we're slowly going to turn our body a little bit more and work on the quadricep side of that IT band right there. Again, we're working from the knee all the way up to the hip and back down again, stopping wherever we feel those points of tenderness and applying direct pressure on them, rolling them out till they release. It's going to help reduce the amount of muscle tension in the muscle group we're rolling over. Okay, once we're done there, we're going to start working on the glute, and we'll start back on the opposite side. So we want to put this above your sit bone, so right in the cheek right here. What we're going to do is cross one leg over the other, and we're going to roll around the entire outer circumference of your hip bone, your pelvis. Okay, and you're going to have to move your body around. That's not a static stretching exercise like you're accustomed to. We're using movement and body weight to loosen up the tension in the muscle. So I've got my leg crossed over here. I'm going to bend the other knee up a little bit so I get a little bit deeper into the hip socket, those muscles that hold the hip tight in there, the piriformis. And again, we're going to go all the way along the sides of the hip bones. When we find that tender spot, we're going to sit down on it. Then we're going to switch sides. Do the same thing. We're going to cross the top leg over, and we're going to start on the inside of the pelvis above the sit bone. We're going to work all the way around by rotating our body. Again, we're looking for tender spots, and we're working with pressure, body weight, to reduce those tender spots. Now what we're going to do is turn over and roll out the quadriceps and the hip flexors. So to do that, we're going to move the foam roller off to the side slightly. And I want you to start with the foam roller directly above the knee. Support your weight on your elbows. And we'll start with the legs straight. Now again, we're going to roll from the knee up and back down again. And we're not just going to work on the top superficial layer of the quadricep. We're going to turn the thigh out and then back in, so we make sure we hit the full length of the muscle from all angles and all the different muscle groups that comprise the quadriceps. And then we're going to turn to the outside, again rolling all the way down to the knee and back up along the full length of the thigh. So I'm going to go ahead and do that on the other side. We're going to turn our body slightly so we can see a little bit better what we're doing here. Again, we're going to place the knee on the foam roller, straight leg, just like so. I'm looking for those points of tenderness. When I find them, I'm going to sit on it, put a little bit more pressure there with my body weight. I'm going to roll it all the way up. And again, I'm going to turn my body, work the outside of the quad, just like that, all the way back down to the knee. I'm going to turn it again, and I'm going to work the inside of the quad, all the way from the knee back up and back down again until you feel like you've gotten all those hot spots out of there. That's great. Now what we're going to do is use the foam roller to release a couple of the muscle groups in the upper body. Now you're getting the hang of how to utilize this tool. And we're going to start with the lat muscle right here. So we're going to place that foam roller directly underneath our armpit. This is going to get a little bit more uncomfortable. Now I want you to work from the lower point of its attachment on the rib cage all the way up to just above the armpit underneath the bicep. Okay, so we're just going to apply gentle pressure. We're going to start on the rib cage. We're going to roll over it And again, muscles aren't flat, they're three-dimensional structures, so you want to work from slightly different angles to make sure we get all of those trigger points out. Okay, so you're going to go ahead and work up and down the full length of that lat muscle. Then we're going to roll it over a little bit, and we're going to work on releasing the chest right here, the pec muscle. You're going to have to turn that foam roller at about a 45-degree angle to your chest. I'll show you what that's going to look like. And again, you're going to straighten out your arm right there. Try to keep the elbow slightly above the chest, and you're just going to roll onto the chest towards the center on that 45-degree angle right there a couple of times. You will find it's tender and tight there. Most of us have rounded shoulders due to a tight pec muscle, so we're just going to roll that out, and then we're going to switch it over and we're going to go on to the opposite side. We're going to start with the lat again, start on the rib cage, roll all the way back up to the armpit. Again, working all the angles. Muscles aren't flat, they're three-dimensional. Working out any hot spots right there. And then we're just going to go ahead and stretch out the pec, 45-degree angle right there, arm out, elbow bent, get our body weight right up on the roller and roll it out right here. And again, points of tenderness, we stop and work out. So that should give you a good idea how to utilize this tool as a stretching aid. And again, the whole concept is that we're using pressure generated by our body weight and the surface area of the roller as a massage technique to release those trigger points, points of maximum tension and tenderness in a muscle. When we release those, muscle tension is absolved, and we get a better improvement in flexibility than we get with static stretching alone. So make sure you utilize this important tool in your prehab kit to get the benefits of improved flexibility. Enjoy that stretch routine.